Good afternoon, ladies and gentlemen. I am Madhav Gone. I lead provider collaboration and interoperability platform initiatives at Healthfirst, New York's largest public insurance company. My previous experience in various technology roles over 20 years includes working at nation's largest public health information exchange, two state health insurance exchanges, largest prescription benefit management company, leading the product development to serve Medicare and Medicaid plans, and one of the largest medical device manufacturing companies in the world. Healthfirst is New York's largest not for profit health insurer, earning the trust of more than 1.4 million members by offering access to affordable health care. Healthfirst takes pride in being pioneers of the value based care model, now recognized as national best practice. I am very excited to be here today as part of FHIR DevDays and especially pleased to share the story of how we started the journey of FHIR, implementing various proof of concepts and learning from them. Specifically, I will be showcasing today how we identified the business opportunity that leverages Blue Button 2.0. Then, how we applied the lessons learned from Blue Button to develop an API for patient access to claims based on the Caring framework. And I will round it off by sharing the current status and touch upon next steps. I joined Healthfirst in August of 2018 to lead our own private health information exchange, or HIE as we call it. 2 months into the job, I was in a major strategy discussion with our CIO, GT Sweeney. He gave us an overview of the digital efforts going on across the organization and his vision of how we want to modernize our integration with providers. He spoke about how we can change the existing processes of batch files and move towards modernized platform including APIs. That set us all thinking of what we should do going forward. Luckily, we got a nice tailwind with the announcement of CMS and ONC proposed rules in February 2019 in the middle of HIMSS conference. The rules provide a mandate for all health plans going forward to implement modern APIs using FHIR as standard. Boom! That was the trigger for us. The path we then took was attending FHIR DevDays at the Microsoft headquarters at Redmond last year. It helped us get a first look, take the pulse of the industry, where it was headed, and all the work going on in the FHIR world. It also helped us understand where we stood and to look for opportunities to move forward. We had no doubt that FHIR is the future and we have got to do something about it quickly. However, we did not want to come up with a POC just for the sake of it. We had to get a buy-in from our rank and file leadership. So we continuously looked for business opportunities where we could then position FHIR as the underlying technology infrastructure that will reveal its benefits to our executives. We identified risk management as one of the core areas where we can use the medical history of new Medicare members provided by CMS Blue Button. That was turning point for us where we could marry actual business benefits with Blue Button using FHIR as the underlying technology. It also turned out to be the perfect use case to build the foundational technology skills we would need in the future. First thing we did was to sign up for the Blue Button CMS sandbox. We got access to the knowledge base and related materials. Then we began working with what we had. At the time, we did not have any FHIR tools, technology, or FHIR servers. But we were confident that we could create POCs with our own current technology stack to gain momentum behind our transition to FHIR. Ultimately, after 2 months of effort, we were able to successfully showcase our first POC that used Blue Button to replicate the experience of a new member during open enrollment. We demonstrated how we can capture member consent and get 5 years of medical history instantly. This was quite a revelation to our encounters team. They really liked the opportunity that was addressing a critical business challenge. You see, we have about 20,000 new Medicare members enrolling every year. The encounter team struggles very hard to get the medical history of new members to come up with risk scores and submit to CMS. And it is not just about payments and risk scores. It is also about assessing records that reveal the true health of our members, which then helps us proactively create the right care plans for them. It falls perfectly in line with our mission, serving the underserved. We shared this workflow with our executives of a use case where we have a member enrolling at one of our many community centers in New York City. The sales rep is sitting with the Medicare beneficiary and getting their consent. They log into medicare.gov and they have immediate access to the consent given by the member. This is how it went. What followed was analyzing the lessons learned from Blue Button implementation and looking at what would be the impending CMS rules. We were also coming up with the other proposals that would further the momentum to invest. One such proposal was a POC for patient access to claims. This was also to create an API in line with the vision of the Caring Alliance, which, as you know, is ability for consumers and their authorized caregivers to easily get, use, and share their digital health information when, where, and how they want. These business use case POCs served another key purpose. They helped us familiarize our senior executives and the rest of the organization with CMS and ONC interoperability rules and FHIR. We use the Caring Alliance guidelines about sharing information with our members and third party apps. For example, getting claims information for our members in the app of their choice. We created a simulation to understand the flow from start to finish. And now to talk about where we are and what our future path looks like. We are at a point where we believe that we will be efficient and effective in our compliance journey by using the right FHIR tools and technologies tailored to our specific use cases. At this time, we are evaluating build versus buy solutions and leveraging our learnings from the previously mentioned initiatives. Whichever path we take, we are confident about knowing exactly what and how we will be compliant within the stipulated timeframes. At the same time, we kickstarted discussions with internal business units, starting with regulatory, compliance, clinical, provider, and claims business operations to explain the mandated changes and their impact. Interestingly, this is also an opportunity to further our digital strategy and position us competitively to better serve our members, our North Star, and improve their overall health outcomes. At this point, I want to reiterate our CEO, Pat Wong's words about dealing with the current crisis this country is going through. She quoted Arthur Ashe, the great African American tennis champion, who said, "Start where you are, use what you have, do what you can." Thinking back at our own journey, it is, forgive the pun, a test of fire we went through to get here. Starting where we were, using what we had, and doing what we can. I'm sure you can all do the same. I wish you all the best in your respective journeys. Thank you very much.